You're listening to Travel Nursing and Allied Life, hosted by TravCon.
Hello, everyone. Welcome to another episode of Travel Nursing and Allied Life podcast. This is the Allied Minute. This is Dylan, your host, and I'm here with Mackenzie. Mackenzie, can you introduce yourself to the listeners, please?
Yeah, I'm Mackenzie Ellis, and I'm an Interventional Radiologic Technologist, and I've been in this field for 6 years, and I've been traveling for 4 of it.
Awesome. Well, thank you so much for joining us, Mackenzie. For those that have been following this series, we are going through and we're talking the big differences between the allied professions and the travel nursing professions. And so if you're a new traveler, this would be great for you if you've been going on YouTube, podcasts, blogs, trying to figure out how to do this whole travel life thing. Travel nursing and allied are very similar in a lot of different ways, but there are some specifics that you should know if you're an allied traveler. And so that's what we're getting into today, as well as if you are joining and you are a new recruiter or recruiter looking to get into the allied space, this will be a great opportunity for you to learn as well. Mackenzie, this is something, so we were just catching up about our good friend Aaron. Something that Aaron talks about a lot is the difference between technologist and technician. Could you describe a little bit about that?
Oh gosh, let's see. I feel like a lot of people classify us as technician in general X-ray because we're just, exposing X-rays and, doing kind of a little bit less than what we actually do. Whereas Aaron and I, we're in a really big specialty that requires a lot more. I mean, we're scrubbed in with doctors, we're operating the X-ray equipment, we're just doing a lot more than what people would, expect. And it's crazy to think of what, my family thinks I do versus what I actually do. It just requires a lot more. So I think technologist it just encompasses a lot more. And especially in our specialty too, there's so much that goes on behind the scenes that nobody really thinks about. Mm-hmm. So I think that's kind of the difference between,
Got it. Are there educational differences between the two?
No, it's the same thing.
Okay.
When we get our degree, it's a technologist, but people just think technician. So
understand. Speaking of education, so when you're getting into this field, what does the education look like? How long is it? And kind of give a brief description of that.
Yeah. So I did 4 years of an X-ray program, and that's all that I'm utilizing with the field that I'm currently working in. But I actually did an additional year, and that was to do radiation therapy, which I don't practice in, and I haven't for a few years, but it's usually 2 years of a prerequisites, and then it's 2 years of the actual program.
Got it. Very cool. Well, usually for travel nursing, they need about 2 years before they're able to jump in and start traveling. Mm-hmm. Is that the same for you, or were you able to jump in sooner?
Yeah, my training took about 6 months. And then I've actually worked with techs that have traveled with just a year of experience under their belt. So you can really, it kind of depends on the field at the moment too, and how badly we're needed. But I feel like 2 years is sufficient for, what we're doing to have the experience. So.
Got it. And are there different settings that you can go within? I don't know if there's difference between outpatient and inpatient, or whether it's facility differences or actual clinical diagnoses that you're dealing with. Are there any different settings?
Yeah. So we do mainly the bigger hospitals that we're working at. It's usually a mix of inpatients and outpatients. I have friends that have worked at outpatient centers where it's strictly just, people coming in, but we do a lot of procedures for inpatients, ICU, and, critically ill patients too. So.
Got it. If you were trying to make that switch either from inpatient to outpatient or outpatient to inpatient, do you have to wait or get some experience under your belt before you're able to do that? Or are you able to jump right in?
No, usually most of the procedures are the same. It's just a matter of if they're actually in the hospital or not.
Got it. Pretty cool. And then when you're getting ready for your contracts, what's the licensure process look like? Is it just one big national licensure and you can go through all the states, or is it individual state licensure?
Yeah.
About that.
Yeah, that's actually the biggest pain about being a traveler. And that's what I was talking to one of my coworkers about today too, is because usually when you have your license, when you're applying for your license for a state, like I just got my license for Washington state, what I had to do was I had to get paperwork from the state of Washington, send it to all the states that I'm licensed in, which are, I think, 8 now. They had to fill out that paperwork and send it back. So it gets to be a lot when you're working in multiple states.
Yeah, therapy is very similar where you have to verify other licensures, but a lot of them are going into like electronic or email at least.
Oh, yeah.
It sounds like they're requiring an actual like physical form you have to send and then wait for.
Oh, okay. Yeah.
But
these I can just email.
Nice. Okay.
Yeah. So it's, I guess you make it seem, you make me appreciate it a little bit more.
Yeah, we're catching up slowly. Well, what does your orientation usually look like when you're coming into a new facility?
It's usually pretty easy. It's usually always the same. It's pretty mundane because you've done it so many times, but you are getting paid for it. So it's, you really can't complain about it, but it consists of modules and just kind of online stuff. And then, usually your first couple of days at the facility, then somebody will be checking you off on certain things and just making sure that you're aware of certain things. So.
Got it. Is it usually like 2 days or a full week or a couple hours?
Yeah, it's usually 2 to 3 days of kind of the online work. Well, it was funny, the contract here, since everybody was still kind of in pandemic mode, I did everything online for the first 3 days at home, which was really nice. And then I went into the facility. So.
Yeah, everything's changing because of COVID. It's crazy.
Yeah.
What does a typical schedule look like for you? Are you doing 312s, 410s, 5/8s, weekends, evenings?
Yeah, ours is pretty standard 410s. And then we do take call, which is nice for me because I can make more money on call. You can pick up as much as you want, or, and also we get to help out the team there too, which I love. I love being able to, kind of take the call load for them too, just to give them a little bit of a break. But we work 410s at the current contract I'm at, and then call is 24/7 past that. We always have a team on call. So it's weekends and weeknights and all the good stuff. So.
Got it. Well, for those recruiters that might be joining, clinically, how would you describe, it should be apparent, but how are you different than a travel nurse?
It's been interesting because since I do work directly with nurses, I always pick their brains on it. And I've, just seeing where they've been and, and a lot of them have settled down here just because people want to stay in San Diego. But what was your question on it? Just the difference between.
Yeah, like clinically, I guess, what's your, compared to like nursing when they're interacting with patients, what's a typical day kind of look like for you when you're treating patients?
We work with, our nurses do the sedation. Our patients are awake for the procedures that we do. So that's a part I love about my job too, is that they're not all just asleep under anesthesia. So, I guess their interactions with the patients is just, providing them comfort, emotionally and, giving the sedation as well. And, I love working with the nurses. I love working as a team with them and, just the collaboration between the nurses and us and the doctors and everything. It's very rewarding. So.
All right. Well, did you have anything else that you wanted to mention just in general about traveling?
Yeah, I urge everybody to give it a try. I actually just met a couple a few weekends ago, and the guy I was talking to, he told me, I usually just tell people I'm a travel nurse because if they don't have a medical background, it's a completely different, it's just really hard to describe. So he actually told me that his wife was interested in travel nursing. And I had to talk to her because, I just think it's something that people should experience, and there's so much good to take out of it. And if I can be a resource to anybody, I love to, I love to talk people into it. And, there's downsides, but there's so many positives too. And I just would love to be a help to anybody who's, on the fence about not doing it, because I would love to talk them into doing it. So, and I'm sure that you're the same too.
Oh yeah, definitely. If you're on the fence, get off the fence. You're going to be scared. Do it anyways. Feel
right. Right.
All right, Mackenzie. Well, thank you so much for joining on. And for those listeners, stay tuned for more Allied Minutes coming to you. And thank you so much.
Thanks for listening to Travel Nursing and Allied Life. You can find the full show notes below or at travcon.org. Please help us out by rating our podcast on iTunes or wherever you get your podcasts.